lot to offer. So I'm looking forward to this talk. Thanks, Jennifer.
Okay, I know I'm the last thing between now and lunch, so I will make this a little quick for you guys. But I know we only have now about 10 minutes to talk about global trends that I know we could probably spend an entire day talking about. So with that said, I'm going to just focus today on privacy, security, and the related workforce challenges. So just a level set, we have had 162 countries have enacted data privacy laws. 17 of those have been done within the last 2 years. And while the content across all of these laws vary greatly, we all know that healthcare data privacy and security is very complex, and it's a patchwork that really requires vigilance and navigation. But for many of us in healthcare, we've already been dealing with and working within a data privacy and security standard that's often much higher than these privacy laws that have been recently enacted, but we still continue to have a lot of challenges. And one of those challenges is the growing risk of cybersecurity vulnerabilities, which of course always result in protected health data breaches. So in the US this year, more than 39 million individuals have been impacted by healthcare data breaches alone. And most of these we know were cybersecurity vulnerabilities and attacks on third-party vendors, while others, they were just direct attacks and resulted in holding data hostage for ransomware. And the European Union Agency for Cybersecurity found ransomware accounts for 54% of EU cybersecurity attacks, largely impacting healthcare organizations. 83% of these attacks were financially motivated, and the most common attack for data breach or data theft was at 43%. And then there was a different study that found 81% of the UK healthcare providers had been hit by ransomware attacks in 2022 alone. And then I'm sure we're probably more familiar with a little bit less ominous but still significant vulnerability is called snooping. We've heard of snooping. Well-meaning family members or friends, trying to set up appointments with providers or just trying to communicate directly with providers. Curious staff doing checks in the electronic records, trying to see some information on someone they might be dating. Or during COVID, we heard about staff checking in on friends and neighbors and colleagues to see if they tested positive for the virus. So all of this clearly against the law. It has its own complications, and some organizations are actually turning to artificial intelligence or AI to start flagging this type of activity that needs to be further investigated. Other organizations are also rethinking emergency management plans related to these data breaches and to make sure they mitigate any particular loss or any issues with records access. So as a trend though, cybersecurity isn't new, it's been going on a long time, but it's definitely increasing, and those that are seeking financial gain are not only disruptive, but they are becoming much more sophisticated. So we know that the biggest vulnerabilities to data security can also be one of our biggest safeguards, and that is our workforce. So I really think these two are tied close together. So I'm going to talk about workforce for just a couple minutes and highlight some trends that I think are really going to impact the industry. So there was a recent global McKinsey study that found that 1 in 4 people could work from home now between 3 and 5 days per week. So this is 4 to 5 times more remote work than before the pandemic. All of us in healthcare, though, we're a little bit skeptical of those statistics, so let me just share what they found related to healthcare specifically. The healthcare sector, so specifically STEM occupations, so those are science, technology, engineering, and math. So think analyst, computer system engineer, statistician, those types of roles. They are likely growing more than pre-pandemic, with the strongest growth in US and China. McKinsey attributes this to aging populations and the need for people to be able to create, deploy, and maintain new technologies to support the increased demand for services. So this study is looking at new jobs and underscoring any conversation about workforce, we have to talk about the aging population, which I know I've heard in almost every presentation this morning, but there are a lot of the workforce that is retiring out and many out of healthcare jobs. So the pandemic definitely accelerated this trend, not only did more people retire, but they were completely burned out, and they maybe found a new job, or they got completely out of healthcare and changed careers completely. In the U.S., our physician and nursing shortages are well known, but those those shortages are hitting health information professionals, and it's expected that around a third of IFHIMA's membership will be retiring over the next 10 years. The World Health Organization also released a report last year warning of a significant pending flashpoint in Europe and Central Asia that's tied to demands on shortages of healthcare workers. So it's not all doom and gloom, though. Here are a few trends that make me optimistic, because I really do think that they can help our workforce grow and thrive. And a lot of these you heard about today in a lot of the presentations. But definitely artificial intelligence, AI, and machine learning is everywhere. There was a paper from the National Bureau of Economic Research predicts that AI is going to help save the U.S. healthcare system $200 to $360 billion annually. Those are huge numbers based on adopting technology that exists today to improve clinical operations, safety and quality for providers, and improve claim and healthcare management for private payers. And the jury is still out on AI. For example, a Pew report found that 6 out of 10 Americans would like AI used in their skin cancer screenings, but also 6 out of 10 Americans would be uncomfortable if their doctor used AI to diagnose disease or recommend treatment. So, while patients, they're still undecided in the use of AI in their healthcare, it is definitely starting to impact processes and workflows for clinicians and patients right now. The most standard use is related to data integration and natural language processing, which estimates about a fifth of healthcare providers have already adopted some form of AI in their daily model, and they're estimating that this is saving clinicians about 3 hours per day, thanks to AI assistance with documentation and just allowing them to spend more time with patients. So we know that technology can improve the patient experience, can reduce clinician burden, but we definitely have to get it right. It's essential that we apply the quality controls, auditing to AI solutions, just to make sure that we are adhering to compliance standards and following any quality standards in the organizations, because AI really, it's not simple plug and play. We have to be really thoughtful in how we implement this work for it to succeed. Clinician and patient experience really matters, so we get one chance at it, and it needs to be positive, trusted, and effective. Something that also needs to talk about in the same breath as AI is reliable information, which is why we're all here. This is always going to be important in the work we do, and it's fundamental for AI to work in healthcare. For reporting and statistics to be accurate, we must first ensure information in the person's health record is accurate. We continue to stress clinical documentation integrity, or CDI, programs to ensure patients' clinical status translates into coded data. That data is then translated into quality reporting, reimbursement, public health reporting, medical research, and the like. So this is another place where AI kind of keeps coming up. So it takes time, it can vary by organization and facility, but this is why AI holds such potential. It absolutely supports CDI teams, clinical teams, and it requires buy-in, though, from all of the stakeholders involved. And then one more trend that's really big for IFHIMA right now is social determinants of health, or SDH. These conditions are in the environment where people are born, live, learn, work, play, worship, and age that affect an individual's health and quality of life. So many of you have already heard this research that only about 20% of a person's health is related to the medical care that they can access and receive. Roughly 80% is tied to social determinants. So I'm going to talk some more about this tomorrow during my keynote, but at IFHIMA, we've developed Data for Better Health. Data for Better Health is an effort to increase awareness of how collecting, using, and sharing SDH can improve individual and community health. So how this gets done is by collecting, sharing, and using social determinants of health data. Health information professionals are essential to this work. The ultimate goal is keeping people healthy instead of treating acute illnesses, and to create public policies that are less reactive but more proactive. I'm very optimistic about this because there are so many opportunities for health information professionals. We can attract a lot of new people to the industry. I think things like AI and SDH are so exciting for new generations of professionals and those that are really looking for a job with a purpose. But it's going to take leadership from everyone here, everyone in this room, to ensure data is being governed appropriately and risk identified and mitigated, to be strategic and thoughtful in how AI and machine learning evolve as tools, and to advocate for SDH data collection, sharing, and use to improve health everywhere for everyone. And I know there's no time for questions, but I'm here through the duration, so please feel free to check me.